My very first thought while I was still in the shower was, oh my gosh, it's the lump.
Oh, I just started screaming. I immediately thought death.
I went home after I had talked to the doctor. I was so upset. I went home and I broke dishes. I threw dishes on the floor.
I was a vegetarian. I did eat eggs and fish, however, but I used to jog about 2 miles a day.
When I was diagnosed with my cancer, it was amazing to me how many of my own friends had shared with me that they hadn't had their yearly mammograms, or they hadn't had mammograms in years.
I'm here to say that you can get through this. You can come out on top of this and you can be better for it.
The fear of having breast cancer can be overwhelming. One of the wonderful things that John Muir allows for a patient is to be able to take this fear and turn it into a very positive experience. And this can be accomplished by a very personalized approach to your diagnosis and your treatment, by state-of-the-art technology, all the new advances that have been made for breast cancer. But most importantly, we can help you go through every stage of your treatment.
With breast cancer, there is good news. This is a cancer that is highly curable when it's detected early. And we offer the technology that provides this ability to detect it early. Women with breast cancer, they not only survive, many of them, they go on to live full, robust lives.
The scary part for me was thinking that going through treatment was going to change me. It was going to alter me some way in a negative fashion. And what I found out through the process, that it's just the opposite. It did change me, but for the positive.
The day I was diagnosed, I remember everything about that day. The first day I had treatment, I even remember what I ate that day. The day my hair came out, and the day it grew back.
For breast cancer screening and diagnostics, we have state-of-the-art equipment within all of our mammography sites. It's great to be able to offer a full range of services to women and to say, yes, we have that here when women call and ask if we have particular equipment like our computer-assisted detection, which aids our mammography and actually rescreens all of our cases. So it's just very nice to be so state-of-the-art that when you go places and you compare services with other agencies, you see how very fortunate we are in this area to have all that we have.
We have come a long, long way. Today, with our screening technology, we can detect breast cancers at a much earlier stage. Not exactly when a woman actually feels a lump, but it can be detected by mammography, by ultrasound, by MRI. And today, rather than going to surgery to make the diagnosis of breast cancer, most women are afforded the opportunity of having a minimally invasive needle biopsy, in which time then they can plan their whole surgical treatment based on a minimally invasive needle biopsy.
A very exciting component to our breast health services is the access that our women have to our second opinion tumor boards. And what that is access to a panel of 6 or 7 medical experts that will thoroughly review each person's case and individualize the treatment recommendations for that person.
So I went online and I saw that John Muir had a tumor board, which was an interdisciplinary board with medical oncologists and surgeons and radiation oncologists and OB gynecologists, and they would review the case and they would come up and present me with what they thought was the best course of treatment, adding that it was also my call but this is what we think would be the best course of treatment for you. Which was exactly what I was looking for.
We have a full physician staff that is offering breast preservation techniques, including cosmetic concerns with regards to breast preservation. We also have plastic surgeons, if a patient does need mastectomy, that can provide all aspects of reconstructive surgery for patients who actually do require mastectomies. Following treatment, radiation has become extremely important for women who do preserve their breast. In addition, the chemotherapy options now are such that most patients can be treated as an outpatient. It wasn't so very long ago that when a woman did need chemotherapy, she often required hospitalization, and she was very sick during her treatment. Today, most chemotherapy is given as an outpatient, and there are so much support medications to allow the woman to continue her life with as much normalcy as possible.
I truly believe that we do provide extraordinary care for women with breast cancer. We offer a full range of ancillary treatments and services, including pharmacy services, physical therapy. We offer one-on-one counseling with the breast health nurse to discuss specific issues, nutrition counseling, classes in navigating your way through chemotherapy, pastoral care, counseling, social services, support groups, including a popular younger women's support group, a lymphedema center, and our breast cancer consultative tumor boards. We also have access to clinical trials, and a woman can decide to enroll in a clinical trial and take part in a nationwide study.
And at the backbone of those resources are our nurse navigators. They will help you through this process. They will help you make sense of what you're about to face, and they're just a phone call away.
When patients come in very anxious, and they can leave with a little sense of understanding or some literature or information to read, it's a first step for somebody to say, I'm beginning this journey of breast cancer and accepting it. So I see my role as helping a patient initially coping with that disease.
The Cancer Center has just been really, really a big support, a big part of the treatment, and it makes a big difference if you have a medical staff that will support you, and when you are just frantic and just as wrong as can be, for them to still be calm and patient and even loving with you, and direct you where you need to go, that makes a big difference.
The people who work with patients who have breast cancer at John Muir are both very educated about this disease, but probably more importantly, they have a passion for these patients. And it's very important to all of us that we give information to patients and offer these treatment modalities with as much love and caring and support that is possible.
I love working with women who are going through these difficult times when they're diagnosed with breast cancer, and because I see them survive and they come back, and it's so nice to see them grow through the process. Yes, it's a difficult time at first, but we get through that part and their lives change, and almost everyone will say it changes for the better.
Breast cancer is a journey. It's a journey that you take that is unique to you. But I want you to know that we're here at John Muir Health to provide the resources so that we can walk beside you in this journey and take you through the resources with the education and the support that's necessary to help you through this in the best way possible.
I would have never thought last year that this year and today I would feel the way that I feel. It's night and day. So I hope that helps somebody to know that you will make it.
The word, when you hear it at first, it's a shock. But when you talk to people that have had it and are survivors, and especially I'm a long-time survivor, all they have to do is look at me and see that I'm alive and kicking and still going strong.
You can kick cancer's butt. Yeah, you can overcome it.
I am a walking example of the value of early detection. I really am. I'm really an advocate for yearly mammogram self-examination and early detection.
I'm alive, and I'm breathing, and I'm happy, you know, and if anybody ever wanted to talk to me about it, that's why I always wear my cancer bracelet all the time, to work even. If anybody ever asks me, you know, why do you wear that bracelet? Well, I'm a survivor.